You've heard us talk about this before here on Robin Hood Radio, but it's an interesting topic. It's an interesting story. It involves education. It involves health. It involves families. And that's why it's important. And that's the project that is going on, that is coming into Webutuck, the Webutuck School District, and that is the health clinic. And there are so many different functions on how this has come together between the group that is going to come in and set it up, Webutuck itself as a school district, how they're going to set it up and how they react. And then there's another function. That is the function of the group that financially has made this possible for Webutuck to participate in, and that is the Foundation for Community Health. And with all that introduction, possibly one of my longest introductions ever, let's bring in Nancy Heaton from the Foundation for Community Health. Hi, Nancy. Thanks for joining us today.
Hi, Marshall.
You know, when I first heard about this project, we were going to do one interview, but it's such an interesting topic simply because it involves three different entities coming together to produce one program that eventually will help families in the Webutuck School District. And the project wouldn't be possible at all without the participation, of course, of you, the Foundation for Community Health. So explain, Nancy, to people what it is you do at the Foundation and how expressly you got involved in helping fund this project at Webutuck.
So hopefully you and most of the area knows that our mission here at the Foundation for Community Health is to improve the health and well-being of the residents of the greater Harlem Valley in New York as well as the northwest corner of Connecticut. And so when we heard about this particular project, to us it was really a no-brainer. It ticked all the boxes for us. It's a project that is going to increase access to primary care, and increase access to oral health, and to mental health services, all things we've been working for the last 16 years, all wrapped up. And even better, it came from the community. It came from the school district. They had, they did the homework. They did the hard work. They figured out that this could really help their community. And so when there was a particular, gap in what they needed, and that happened to be, funding for some construction, space. The board was like, yes, this is exactly what we're looking for in our community, because that doesn't come often, that you get that opportunity where the community itself defines the issue, finds a solution, and then works with us to make that happen. It's just a perfect storm.
What's great about the project, the health project at Webutuck, is that it takes one more component to me. Once it's constructed and fully implemented, it takes a big problem off of the hands solely of the Webutuck School District and opens up a venue, an avenue for families that are in the Webutuck School District that have students to really improve the health, keep the health safe, and find something before it happens. And that's what's so interesting to me about it is it supplies a product, which is health, access to health, and also a way to cut the costs of health for parents and students all in one program.
Yes, so it overcomes the rural transportation barriers, right? So people don't have to take time off from work to bring their kids to the doctor, or they can be screened by the school nurse. I mean, the school nurse is still an important part of this. And then if they have permission, they can go to the health center, and the health center will have a relationship with a local pharmacy and be able to, seamlessly sort of provide some assistance. They can also help improve vaccination, compliance, because sometimes that's also difficult. I have 3 kids, and I know every year, if it wasn't for my other half, I'm not sure we'd all line up and get, the vaccinations, because it's something out of the ordinary. This can actually happen on campus at the school. And the other bonus is that there is a very strong correlation that has been found between health issues and academic and even graduation success, right? So if we're doing things like preventing cavities, dental pain is one of the number one reasons that people don't go to work or school, and we have been funding dental programs for many years. This one will actually be self-contained and self-sustaining. in this school. Asthma is another issue that can come up. And then most exciting also is to increase the access to mental health services, which are few and far between in our community. And they will be able to provide those services right there on campus, and hopefully preventing more acute stages of chronic diseases like asthma, oral health, or even an ongoing mental health issue, and increase, attendance. And attendance alone can have an impact on graduation and academic success. So it's very exciting. The whole thing is just, like I said, a perfect storm.
And what's great about it is that it's for everybody. It's for low-income students, middle-income students. It doesn't matter. This program does not discriminate on wealth, on earnings, on ethnicity, or anything. Once it's instituted, it's for every student that's in the Webutuck school system there.
Exactly, because it is run, Open Door Health Centers is a federally qualified health center. Much like Hudson River Healthcare, they have a federal mandate, to see people regardless of ability to pay, and they receive, supplemental funding to do that for communities, to be able to, and a community like Webutuck, which does have, I think it's up to like 60% of their student population are either or underinsured, school. Are eligible for free lunch or reduced lunch programs. So this is a community that could use a center not only physically on site to make all of those things that we've talked about already more accessible, but also more affordable.
Unfortunately, with the onset of COVID-19 and the pandemic, the actual implementation of this program has probably been pushed back by at least 8 to 9 months. But also, when you look at it, with the pandemic, it would have been a great program to have in place already, because it would have benefited students and families enormously in the school district.
I think so, and actually, given the delay, it will also give school districts and the state of New York some time, because the state of New York has lots of rules and regulations on figuring out, what the best role of community or school-based health centers can play in helping the school district handle COVID-19 reoccurrence or any other, epidemic or infectious disease, even the flu. It can help mitigate some of the impact, I believe, because you're going to have, either a nurse practitioner or whatever the qualification of the highest level medical personnel is going to be there. It will help. And even if there's a stressful thing that happens within a community, they're going to have the mental health services on board to help with that community right then and there. So the time drag between actually responding will be eliminated. So.
We're speaking with Nancy Heaton from the Foundation for Community Health. Once this program gets implemented and active and up in Webutuck, is this something that can possibly come to like a Connecticut, Region 1, or any other district in the state?
Oh, absolutely. We are working very closely with the Community Health and Wellness Health Center out of Torrington, which, full disclosure, I was on a founding board of, and also helped pull together some of their programs, way back in the early days of that organization. And we have been in constant contact with them about how to improve the access to their services in our community, and hopefully we'll have great news on that front sooner than later.
Well, Nancy, thanks for taking a few minutes and joining us. It's, like I said, we've interviewed 3 people now, but from 3 different avenues and angles of this program that's going in at Webutuck. I appreciate your once again coming on the air, and good luck not only with this program, but with the other program you're working at, possibly for residents of Connecticut.
Yes. Well, take care.